since this pandemic began. At the same time, the number of cases continues to surge. 183,000 new infections were reported on Wednesday, just one day alone. Overall, 12.8 million Americans have contracted the virus. I'm going to go live now to Dasha Burns. She's been in Tennessee where rural healthcare workers are stretched thin. They are trying to keep beds open among the cases and among the surge in that area now. And Dasha, tell us what you're learning from healthcare workers there.
Hey, Corey, good morning. Right now, there are a lot of Americans waking up, getting ready to make maybe a smaller than usual Thanksgiving dinner. And it's a challenging time for a lot of us right now. But look, in this building behind me, there are healthcare workers who are caring for patients who are fighting for their lives right now. There will be calls made to funeral homes today, and that is a grim reality to talk about on a Thanksgiving morning, but it is the reality. They have seen record numbers of deaths here in just the last couple of weeks, and at this point, the rate of admissions to these hospitals in this area is greater than the rate of discharge, which means there are more people coming in than there are coming out, and that is putting a lot of strain, particularly on the nurses here. And I want to bring in one of those frontline health workers here. This is Abigail. And Abigail, walk me through what you've been seeing, especially over the last couple of weeks compared to what you've seen throughout the course of this pandemic.
So in the beginning, this really was not, I guess, taken as seriously as it is now. It wasn't expected to be as big of a deal as it is now. We started out with 1 to 2 COVID units, whereas now we have 5 to 6 units.
What are you seeing in those COVID units, especially over the last couple of weeks?
You know, it's a wide variety of patients. You can have older patients with the underlying health issues, or you could have patients in their younger 30s that are completely healthy, and it still affects everybody just as hard. And it's a little bit harder now during the holidays and with the restrictions because of COVID that they can't have family with them, or they just may not have family in the area. So we become their family over the next couple of weeks while they're with us or until they pass on because of COVID.
And this is a community where people are tight-knit. Everybody knows everybody. So the folks you're caring for, they're not necessarily strangers. They're your neighbors. What is that like?
It's definitely hard to see people that you know, or maybe like a high school teacher or friends of family, you know, and caring for them and seeing them like that. Because, I mean, like I said, everybody becomes family whether you knew them to begin with or not.
Abigail, thank you so much. You're doing such incredible work. And right now, there are nurses like Abigail who are getting sick. About 250 team members in the Ballad Health system right now are out with COVID-19 who have tested positive, who are recovering right now. And they're looking for help. They're looking to recruit more nurses, trying to bring folks out of retirement to help. They're even getting some people from international communities here to help out. It is just such a critical time. And the message that I keep hearing, the folks in this community, what they can do to help: wear a mask, sanitize, social distance, and stay home if you can. Corey?
And that's the message that we're hearing across the country, too, is that there is going to be, they anticipate, a shortage of healthcare workers, those critical frontline workers. Dasha Burns, stay safe out there. Thank you. There is much more ahead, including more than 20 days after